Hey, everyone. I hope you've all had a safe and happy Thanksgiving. As you all know, we are in the middle of a major surge in COVID cases. So I'm grateful to Dr. Fauci, both for his leadership so far during this pandemic, but also for joining us today to discuss where we go from here and how you can all stay safe. And we're also going to spend a lot of time discussing potential vaccines and all of your questions around those. So for those of you who are not familiar, Dr. Fauci is our nation's leading infectious disease expert who runs the National Institute for Allergies and Infectious Disease. So thank you, Dr. Fauci, for joining today. And I'm hoping that maybe you can start off by giving us your sense of the current trajectory. Right, there are almost 200,000 new reported cases in the U.S. every day now, and that may undercount some cases that are not reported. So where are we in this? And what do you think the overall infection rate and trajectory looks like at this point?
Well, Mark, thanks for that question. It's important because we're in a very precarious situation. When you look at the numbers, almost every day either breaks a record or ties a record of cases. To have a baseline of between 1 and 200,000 cases a day is extraordinary. When you look at the number of deaths, they're between 1,000 and 2,000. We're now over 90,000 hospitalizations. The total of the outbreak is over 250,000 deaths, 266,000 deaths, and over 13 million cases. If you ask, and you did, about the trajectory, when we had the spring in March and April, when it was dominated, the outbreak by the Northeastern corridor, particularly the New York metropolitan area, the slope of the curve was like this. When we got to the early summer, when the southern states tried to open the economy and did it in somewhat of a disparate way, we had a surging of cases in Florida, Georgia, Texas, Southern California, and Arizona. And the slope was still like this. Our baseline was between 40 and 60,000 cases a day. What we're seeing now, which is a confluence of entering into the cooler months of the late fall and the early winter, the holiday season where people congregate on indoor settings, wonderful, innocent things that we do socially with our family and our friends, having meals in congregate settings. The slope is done this. It's on an increment that is almost exponential, which is really dangerous situation to be in, particularly as we get deeper and deeper into the cold months of the winter, and we have the Christmas holiday coming up. So you ask a reasonable question. The trajectory is we're in a very precarious position. So the obvious question is, what are we going to do about it? You mentioned vaccines. We'll talk about that later. That's on the horizon. But before we get vaccines, we're going to have to deal with something that is very, it's literally record breaking every day. So what we have is maybe 5 fundamental public health measures that are pretty easy to implement. Uniform wearing of masks, keeping physical distances, 6 feet, if you can possibly do that. Avoiding crowds in congregate settings, particularly indoors. And that means typical things like gatherings in restaurants, gatherings at homes, where people other than the immediate family unit are together. The reason we say that is that the infection in the community level now is driven by people who are without symptoms, because about 40 to 45% of the people who are infected have no symptoms. And we know that a substantial proportion of the people who get infected from someone who doesn't even know they're infected. That's one of the reasons for the uniform wearing of masks. I wear a mask not only to protect myself, but prevent me from infecting you, and you wear a mask for the same reason for me. The other thing is to try, as an extent possible, to do things outdoors preferentially over indoors. That's going to be tough when you're dealing with states in the northeastern part, the central part of the country. I mean, you're not going to be doing many things outdoors in December in Minnesota, that's for sure. But we need to try and do that as best as possible. If we do those 5 things, with hand washing being the 5th thing, we know when you have one state next to another and you have disparate implementation of public health measures where one state does not uniformly wear masks, doesn't close bars, has full capacity in restaurants, and compare it to a similar demographically and geographically similar state that does all those things, that has uniform wearing of masks, maybe even a mandate, doesn't have bars open, has limited capacity in restaurants, and essentially has a public health mandate. The difference in how that increment goes is this versus that. So there's something that we can do. We have it within our power to get ourselves through this until we ultimately get a vaccine, which would be, as we say, help is on the way, but it's not here yet. So we can do these things and we can prevent an even further escalation. I referred to it on one of the Sunday shows yesterday as a surge superimposed upon a surge. What we've done now with Thanksgiving, Mark, we're not going to see the repercussions of that for 2 to 3 weeks from now. So because of the travel and people congregating for meals, et cetera, you don't see any difference for a day, 2, 3, 5 days. You see the difference 2 or 3 weeks from now, which would put it right at the time that people would be traveling for Christmas. So all things considered, we're not in a good place.
And I've heard you talk about different age groups that are being affected potentially more than is the conventional wisdom at this point. What are you seeing in terms of the different groups that this is affecting at this point?
Yeah, in the beginning, Mark, and that's one of the things about this outbreak that people have to realize. We need to be humble and realize that at any given time, particularly early on, we don't know all the answers. And there was a rather, I think, almost an artificial dichotomy that young people do really, really well. They get infected. Most of them have no symptoms. They don't get into trouble. The elderly and those with underlying conditions, they have a higher incidence of the severe consequences, which lead sometimes to hospitalizations, intensive care, and account for most of the deaths. Generally speaking, that's true. But what we're starting to see now, as we get months and months into it, that a substantial proportion of the people that are getting hospitalized are between 40 and 59 years old. That's not an elderly 80-year-old person. And those people can get into trouble. And in fact, I have to tell you, just 3 days ago, on Friday, when I made rounds in my hospital at the NIH in the clinical center, we went in with a man who was 37 years old, who had serious lung involvement. And right now it's touch and go. So this idea, if I'm in my 30s, my 40s, my 50s, I'm okay, be careful. It's not the usual situation that you get someone that age. Clearly, overwhelmingly, it's those with underlying conditions at any age and the elderly that get into serious trouble. But there are enough people who are younger who get into trouble that we can't just blow this off as being insignificant for the younger people.
And what do we know at this point about the long-term effects of this? I mean, there are certainly those the long haulers who have symptoms for 3 months or 4 months, or I've seen reports of 6 months. And I imagine we're starting to study some of the long-term effects of the disease as well. Can you give a summary of what our current understanding of those impacts is?
Yeah, that's a good question that often gets confused, Mark. So there are 2 types of post-COVID involvement with symptoms and signs. One of them is the one that you refer to, which we refer to probably, we got to get a better word for it, long haulers, but that's what most people have been calling it, are individuals who either had symptoms, stayed at home for a week or 2, had fever, aches, a little shortness of breath, or even people who've been in the hospital, who've had stays in the hospital and come back, who clear the virus from their body. So the virus is no longer there. And yet, maybe 20, 25% of those people, and we got to get the number more correctly because it hasn't yet been studied as well as it should be, and we will be doing that these people have an unexplainable symptom complex that seems to be consistent among them without any laboratory data to indicate why they may be feeling that way. Excessive fatigue, shortness of breath, whereas people who are good shape athletes have trouble climbing a flight of stairs, sleep disturbances, what's called dysautonomia, where you get temperature fluctuations, where you feel flushed, and something called brain fog, another unfortunate word, which really means they have difficulty concentrating and focusing, where you're looking at a computer screen and you just can't focus on what you're doing. That's the thing we're seeing now, and that could last from weeks to months. There's another kind of effect that is quite well documented with laboratory data. For example, if someone goes in the hospital with COVID, they get difficulties breathing, they get intubated and put on a ventilator, they get pneumonia. When they recover, because they have such damage to their lungs or sometimes to their heart or to their kidney, it may be months and months and maybe even longer, because we don't know yet, because we've only been doing this for less than a year, where they have organ system dysfunction that is residual, maybe indefinitely. So the idea that you get infected, you either get no symptoms or you die, and if you don't die, you're okay. I think that's really a misperception, that there are going to be a lot of things that we're going to be following that people are going to have trouble even after they recover.
Yeah, that makes sense, and it'll be important to keep studying. So as we head into this holiday season, you went through a number of recommendations for people to stay safe. And it may not be possible to boil this down to just one thing, but just I'm curious if you could give people just one piece of advice to keep safe heading into the holidays. What would that be?
Yeah, that would be, and this doesn't sit well in the issue of how customary Christmas and New Year's and Hanukkah and all that have been traditionally for the family unit. That we're going to have to, if I recommend one thing, is that diminish to the extent possible travel and keep gatherings indoor to the immediate family unit. To the extent possible, don't have people who may have traveled from one state into what you are, a friend of a friend who brings a friend. Try to keep the home environment as much as possible confined to the immediate family unit. That seems to be, unfortunately, Mark, the antithesis of the Christmas, the New Year, the Hanukkah season, because you really want to bring friends, the warmth, the fireplace, the people sitting down together. Unfortunately, that's the perfect setup for people who might have no symptoms and innocently and inadvertently come into the home and infect someone. We see that every time you have a situation socially that leads to congregate people getting together. So my bit of advice would be, I know as difficult as this is, each family needs to do